Imagine it is 2 in the morning. You wake up drenched, your heart racing, your sheets soaked. You throw off the covers, stand by the open window, and still feel like your body is on fire. People around you say it is just menopause, it will pass. Here's the real shock. Hot flashes are not just annoying, they're linked to higher risks of heart disease, bone loss, and even memory changes. And now there's a brand new non-hormonal nighttime pill that targets the brain circuit behind them. In this video, we'll break down 5 big myths about hot flashes that many women and even some doctors still believe. Then we'll talk about the new medicine called elinzanetant, brand name Lynkuet, how it works, who it's for, and why it's making headlines. By the end, you'll have a science-based map of your options, so you can have a stronger conversation with your healthcare provider. Myth number 1. Hot flashes only start once you're officially in menopause. In reality, they often begin in perimenopause, while you're still having menstrual cycles. Estrogen levels are already rising and falling in an irregular way, and that confuses a tiny thermostat in your brain called the hypothalamus. Myth number 2. Hot flashes don't last very long, so you should just tough it out. On average, troublesome hot flashes last 7 to 8 years, and for many women, they continue for a decade or more, especially for Hispanic and African American women. This is not a brief phase. It's a long chapter of life with real consequences for sleep, mood, work, and relationships. Myth number 3. If it's natural and on the shelf, it must fix hot flashes. Pharmacies are packed with menopause gummies, herbal blends, and soy pills. In careful trials, most have not done better than placebo, which on its own reduces hot flashes for about half of women. You should be cautious about any supplement that promises to erase hot flashes without strong science behind it. Myth number 4. There are no real non-hormonal tools, so it's either hormones or nothing. Certain lifestyle and mind-body approaches do have evidence. Structured weight loss can reduce hot flash frequency, especially when extra weight around the belly is involved. Cognitive behavioral therapy can lower distress and improve sleep. These methods do not cure hot flashes, but they can lower the volume and work well alongside medical treatments. Myth number 5. Hot flashes are just a nuisance. We now know they're linked with higher risks of cardiovascular disease, osteoporosis, and cognitive changes later in life. Women who have frequent, severe hot flashes are more likely to have stiffer blood vessels, higher blood pressure, and lower bone density. Hot flashes are not simply discomfort. They are a red flag that your body is under stress and deserves real medical attention. So where does the new pill, elinzanetant, fit in? For years, the most effective treatment for hot flashes has been hormone therapy, with estrogen, sometimes combined with progesterone. For many women under 60 or within 10 years of their final period, and without certain risk factors, hormone therapy is still the gold standard. But some women cannot safely take hormones, especially those with a history of hormone-sensitive breast cancer or blood clot risks, and some simply prefer a non-hormonal option. Elinzanetant is part of a new wave of non-hormonal medicines that work not on estrogen itself, but on the brain cells that react to changing estrogen levels. It blocks key chemical messengers in a network of neurons in the hypothalamus that acts as your internal thermostat. When estrogen drops in menopause, that network becomes overactive and starts firing off hot flash signals too easily. By calming that network down, elinzanetant helps reduce the number and severity of hot flashes and night sweats. Many women in large studies also slept better within the first few weeks. This medicine is taken as a capsule once a day at bedtime, with or without food. The United States Food and Drug Administration recently approved it for moderate to severe hot flashes and night sweats related to menopause, based on several large clinical trials. Women taking elinzanetant had significantly fewer hot flashes and reported better quality of life compared with women taking placebo. Some common side effects included sleepiness, fatigue, headache, dizziness, and changes in liver blood tests. So doctors will usually check your liver before and after you start the medicine. For women with a history of breast cancer who can't use hormone therapy, this kind of non-hormonal option is especially important. It is very important to say this clearly. Elinzanetant is not a magic bullet, and it's not the right choice for every woman. It's one option in a toolbox that also includes lifestyle changes, cognitive behavioral therapy, hypnosis, some antidepressant medicines, the older non-hormonal drug elinzanetant, and, for the right candidates, hormone therapy. If you're pregnant, trying to conceive, or have serious liver disease, this drug is not appropriate for you. Some women may also find the cost a barrier, although assistance programs may help in some cases. If you're living with hot flashes, here's the real takeaway. You don't need to suffer in silence or feel ashamed. Track your symptoms for a few weeks, notice your triggers, and then sit down with a healthcare professional who takes menopausal health seriously. Ask about your overall heart and bone risk, talk honestly about hormone therapy, and ask whether a non-hormonal option like elinzanetant might be a good fit for your medical history. And if this video helped you feel more informed and less alone, share it with a friend and leave a comment with one thing you wish more people understood about menopause. Your voice could be exactly what another woman needs to hear today.